Nice.
That does it!
Oh!
Canada!
Oh my gosh, that's definitely how majority of the patients I see that come to the emergency department with a broken hand due to punching something probably feel. Typically what ends up happening is a classic boxer's fracture. Not an injury like Deadpool here, but you typically see a fracture of the metacarpal.
That's not good.
And you can see like his wrist is just floppy everywhere. You can get a wrist fracture with different types of trauma due to pushing your hand out to try to brace yourself versus coming across and hitting something.
Please.
Shot.
Oh!
Your poor wife.
Typically, we don't see bilateral hand fractures like that. You could, but then you get worried that outside of hitting somebody who's made of steel, why is somebody breaking their hand so easily? There's something called osteogenesis imperfecta.
Osteogenesis imperfecta.
Where somebody can get very easy fractures.
You really should stop.
Oh, the dinosaurs feared the T-Rex.
Oh my gosh. You see just these two lumps like right here in the wrist. You know, could that be a depiction of the distal ends of your radius or your ulna? Could be, but you also have a ton of wrist bones, as well as, again, all of the metacarpals. Oh!
I promise this gets worse for you, big boy.
Oh my gosh, look how badly displaced that ankle is. So you're snapping it. You're gonna have what's called a trimalleolar fracture. Fractures of 3 different areas of the ankle, also relating to ligament injuries, tendon injuries, and possibly a dislocation.
You ever hear of the one-legged man in the kicking contest?
Do you have off switch?
Yeah, it's right next to the prostate. Or is that the on switch?
Enough.
Oh. Talk about like the idea of like spidering the windshield. You worry about obviously some whiplash injury. Ends up most of the time with cervical strain of the muscles of the neck. Definitely if you're having any pain to a specific area of a bone, it needs to have imaging to make sure you don't have fractures.
You ever see 127 Hours?
Oh my gosh, so a movie referencing 127 Hours is where the individual gets their arm stuck in a crevice and ends up having to cut off his own arm. Oh my gosh. I can tell you, for one, because I've done amputations before, cutting through all that tissue is not easy. Yes, it is messy. We do it very systematically where when you cut through the tissue, anytime you see a small blood vessel, it's going to get cauterized. If you see a little bit bigger blood vessel, you actually need to tie it off before you cut it.
Are you there, God? It's me, Margaret.
Oh! When it comes to cutting the bone, you use a saw to cut it. You wouldn't necessarily cut it straight across because you need tissue to be wrapping around the end of the bone, otherwise you have exposed bone.
I'm gonna rip you in half now.
That is such a juggernaut thing to say.
Oh! Oh! Juggernaut. I remember as a kid, I used to have Juggernaut like action figure.
Juggernaut!
Ripping a human in half. Obviously, we know this is very far-fetched. We just see a ton of blood pouring out. You're ripping through the major blood vessels that run through the pelvis abdomen there, which would include the inferior vena cava as well as the abdominal aorta.
Oh my God, I can't feel my legs. I can't feel. Oh no, they're right here.
Could he potentially feel his legs? Maybe, might be able to feel the pain, or he might feel obviously nothing. Most of the time in the acute injury, you feel nothing, which is very, very scary. But then later, after the damage is set, the swelling is gone, sometimes people can have phantom limb syndrome.
Maximum effort.
Oh, yes.
Yes.
Normal person, not Deadpool, that would cause significant injury, breaking through glass, but you're still causing trauma to your feet and your spinal column. Oh, massive road rash, eating away the tissue. A lot of times what ends up happening, you get deeper than the blood vessels, and you're gonna need a skin graft to have this area repaired. Ooh, a lighter. Oh, anybody's car still have one of these lighters? I don't think mine does anymore. Burn the guy's forehead. Hopefully that burn doesn't go all the way through. That needs to have repair to where you have to have a skin graft on your forehead. Typically deep 2nd degree burns and 3rd degree burns will require that. shot through the right forearm and all the way through and through. If the bone is injured, it needs to be taken to the operating room and washed out. You get significant concern for osteomyelitis, which is the infection of the bone. Oh, posterior, the exit wounds through the skulls have a significant amount more of trauma, and that just has to do with the force that it's going through and the energy that it takes with it. One bullet versus like 50 just depends on the areas that you're getting hit. Oh, well, you guys know weapon in the body. What do? Of course, you do not pull it out. This also reminds me, for you, my Dr. ER audience, I have a special discount code for my Life Happens supplements. Don't pull it out, 30. Oh, flying into a metal post like that. Most people will end up getting soft tissue injury. A big bruise, ecchymosis.
Ecchymosis.
Basically meaning pop blood vessels underneath the tissue, typically purple, blue, and then over time will turn like a greenish yellow. You definitely want to double check and make sure that there's no fractures. Ow. Is that knife in his head? Oh my gosh. Holy crap. Does this happen? Rarely. I've seen many people come in with the attempt of a knife to their head. Typically the skull is resilient enough that it bounces off, as well as spherical, so it's hard to actually have that point go in. Oh! When somebody falls like this, gets caught, you worry about whiplash injury.
I think I got whiplash.
Spinal cord injuries because of being pulled, as well as any groin discomforts because the parachute gets caught and pulls up on the groin.
Stage left, you idiot!
Oh my gosh. Typically, our blood as human beings is red. Despite what people say out there in the universe where they say our blood is blue, it is not blue. It might look blue through the skin, but no, it has nothing to do with when the blood hits oxygen. Does it change color because there's oxygen in your blood? So no, the blood is red.
Vanisher. Maybe the wind.
Oh my gosh. Somebody gets electrocuted, you basically check, for pulses, look, listen, feel, start CPR, get an AED, an external automated defibrillator, get the individual to the hospital.
X-Force! X-Force.
Oh no, I know what's gonna happen. Oh no. Typically the injury that we see relating to heavy machinery is a hand, usually, or a limb getting stuck at work or something and it gets tore off. Most of the time you can't reattach it and it's just an amputation at that point, unfortunately.
Peter.
We're X-Force.
Whoa. Oh my gosh. What the heck? There are some chemicals out there that can definitely get on your tissue and cause significant amount of trauma or injury. Typically, if anybody comes in with like a chemical exposure, we need to know what the chemical is, and then we'll actually call poison control ourselves. In the United States, it's 1-800-222-1222.
Look at this left hand by Whaley.
Getting like clobbered punches to the face or around the eyes. Obviously, the eyes are in our eye sockets and they're actually protected by the bones around that area. There's a lot of blood vessels. What ends up happening is as you get hit in those areas, the tissue swells and you get these really large hematomas.
Inside low kick, right hand by Whaley.
If you do have a big hematoma, ice to the area is probably helpful right away, and also a compressive dressing. That way it doesn't just continue to expand underneath the tissue. You put pressure on it. Her nose looks a little crooked, definitely has a lot of swelling around the right eye. Sometimes you can get a fracture of the infraorbital wall, and that'll cause a significant amount of swelling. If you sneeze, you're taking big breaths, you increase the risk of getting subcutaneous air because that infraorbital wall is actually the superior wall.
Oh my goodness, look at that left hook. Look at this spinning back fist.
The spinning round hit with the outer aspect of that right hand may be the fifth metacarpal, which is actually the smaller bone that actually fractures a lot. When somebody punches another individual and they hit with that area, you get what's called a boxer's fracture.
Boom! My goodness.
Hitting on the side of the head actually is a scary part because you have your middle meningeal artery, really dangerous of bleeding, and it can cause an epidural hematoma, which could be life-threatening if you're not aware that it's going on. Ooh, where'd he get hit? Oh, that left lower extremity. Oy vey. Definitely has a lower tibial fracture, probably. Most likely the fibula broke as well. Structural support of the left lower extremity is useless now. This is probably a fracture that was pretty small and then just got exacerbated due to the activities that these guys do. Oh!
There it is again. That left high kick.
So big kick to the side of the head. It was actually a shin that actually looks like it hit the side of the head. You worry about skull fractures, intracranial bleeding.
And Bisping is opened up and in all sorts of trouble. That'll do it. Vitor, go for it.
Oy. Hitting abdomen, ribs, increase the risk of having fractures, a pneumothorax and a hemothorax. Got to be really careful, and the referee needs to step in at this point because individual on the bottom is not defending themselves. Oh, a retinal detachment to his right eye due to the kick to the head. So the retina sits on the inside of your eye, not the whole thing on the inside, but majority of it.
Not all of it.
It's got all those specialized cells that when the light and the images come into our eye, it goes through the lens of our eye, and then it gets shown to the retina, and the cones and the rods allow it to make an image to then send it back to our brains.
Look at this, baby boys. You know what I mean? You know what I'm saying?
No, this guy just took out a prosthetic eyeball out of his eye socket, which is not a retinal detachment. Retinal detachment, the eye is still intact. Oh, fractured shin. Oh, man. Mid shaft, you're hitting bone on bone. Typically, it's because these guys do so much hitting. Sometimes if there's a small defect due to a small minor fracture, then snaps all the way. Is that Chris Weidman? Yes, it is. Oh. Potentially needing a medullary rod versus pins and plates in there. Resetting it, making sure appropriate alignment. You really wanted to get realigned, and you worry about the vascular aspect of it where you don't want the pieces of the bone actually cutting into the vessels.
Come on, take a look at it here. Look at this.
I'm not gonna look, Joe. Just tell me.
Oy. For us to check that, obviously we're checking pulses, reassessing to make sure the perfusion of that leg is good, meaning is it pale? Is it cold?
Look at this. Kimura to Frank Mir. Can he
Oh gosh, oh gosh. Oh god, this is like, oh. I saw a little extra give and snap, and so, oy, most likely elbow. Snapped. Oh, that is. Or could be mid-shaft humerus. The forearm looks like it's intact, but the way that the arm was being spun and rotated, I've seen people who snap their humerus, especially when they're doing like arm wrestling. You can actually have a spiral fracture of the humerus.
To her left.
Good right hand by Eye, and that caused a cut on the ear of Leslie Smith. You can see the cauliflower on
Oh, yeah. Cauliflower ear basically occurs when you get direct trauma to the ear, and it causes a deformity to the ear itself, typically due to the fact that you're having inflammatory cells go there, you're having blood in there.
Watch this punch.
Ouch.
Look at the blood.
Oh, you can see the blood squirting. The question ends up being, was the cauliflower ear already there and the laceration open up the wound to allow the blood to squirt out? Or was there a new laceration that occurred? There are branches of your external carotid artery that come up right in front of your ear. So that could be something that we would be concerned about.
Big strikes now from Brooks.
Oh, we got a lot of blood coming out. Oh my gosh.
Oh, that's a horrific cut.
Face bleeds a lot. Stitches to the face are pretty easy, and the face heals really, really well. You can use absorbable stitches versus non-absorbable. That is a bad cut below that eye.
A faucet of blood coming out of that bad, deep cut under Alessio's left eye.
Sometimes when it's so split open like that, you can do a few underneath absorbable stitches. That way it brings the tissue close and decreases the tension from the surface. So that is quite helpful. Oh yeah, look at that. Obviously, took a lot of trauma to the face because the nose is really swollen as well. This will swell up. You worry about any fractures around the area. You want to check the eye too. We'd probably do an eye exam. If there was that much trauma to somebody's face, depending on how the patient and the individual feels, do you do a CT scan of the head, neck, and face to make sure that there's no other trauma? Blood in itself stains pretty badly. The mats that they use, I wonder if there's a covering to it that they need to then throw out. Oh! Oh, no. Individuals awake, you can see the legs moving, but that was a loud noise to the head and face. Oi, look at that skull fracture. Holy cow. The frontal bone there, it does actually behave almost like a thinner bone because of the frontal sinus. The reason why you would actually do this, besides looking for the fracture right on the front, you want to make sure the fracture doesn't go into the brain, okay, into that cavity. That is a CT scan image that's then been reformatted for bony structure. So you're doing a CT scan, probably head, neck, and face because of the whiplash that you would get from this injury.
Connie surfed the internet for the cheapest boob job she could afford.
Some things you don't want to skimp out on.
Any surgical procedure.
How many botched surgeries have you had because you work near the border?
More than I can count on fingers and toes.
Okay, just tell me what it is that you want.
I want melons, I want gazonka.
Do you ever refer to your breast tissue as melons and gazonkas?
I don't think I've ever used those words, but we definitely get creative in the female community. Tatas.
Yeah. Yeah.
This quack would do anything as long as you paid cash.
At least she's in a gown.
But the gown is backwards because you would think at a plastic surgery office you'd want it exposed.
Our gowns, the sleeves button all the way up. So if I need to expose the chest or the anterior, you just open a couple of the buttons and just have a small flap. That way you're only exposing a very small area of the patient.
I promise to give you the biggest tatas in all of Southern California.
And all of Wait, what did he say?
The biggest tatas in all of Southern California.
Oh.
He's your colleague.
Yeah.
Let's go and cut this bimbo open.
This feels
Whoa.
like some back alley
We
business.
just jumped into a non-sterile surgical area without anesthesia. She's on oxygen. I'm assuming it's got gas.
No nurse. There's a teddy bear, so I can only imagine the loose hairs may get...
All in that area.
2 weeks later, Connie ordered a flight to
all right, so we didn't get
Vegas
to see the
on
surgical
November.
practices. You also have to be really careful, like going too big too quickly. You stretch out the tissue so much that you actually can decrease the blood flow potentially.
Turns out she got what she paid for. Her plastic surgeon had used substandard implants, barely one step above water balloons.
I was just gonna say
Wow,
they look like
they
water
do look
balloons.
like water balloons, and there's like air in them.
Oh, that's not good.
They had no business winding up inside a
Okay,
woman's chest.
not to mention he has no gloves on and he's just like
Got
doing
it.
a juggling act.
He's got an N95 on at least.
Good thing he's protected.
Right, he's protected.
As the plane climbed out,
Oh, no.
the
Oh,
gurgling
the
noise grew
expansion.
louder.
Oh my God.
No, when you... Yes, the expansion.
yeah.
When you go up in altitude, it starts to expand. Feet swell up, your bottles are really wide, and people have a lot of gas on the airplane.
That stripper's gonna bomb in her chest!
Oh,
Got a bomb.
When the plane hit 20,000 feet,
oh my gosh. What? I can't believe that's real. Why wouldn't the implant itself just rupture and not the skin? I don't know if she passed away or not. She would bleed out or something like that from the major vessels that are in that area. It's just soft tissue injury.
but when some workers get high on the job, they don't work. They play.
Oh, jeez.
Oh.
They're talking about smoking cannabis here. It does cause impairment. You can use it medicinally, you can use it recreationally, but it doesn't mean you can use it while you're on the job and while operating heavy machinery. You have to think about it like any other medicine per se, or anything that alters your senses.
A rope and a forklift is all these two need.
And of course he's listening to music and he has no idea what's going on with his buddy.
It's like red flag 1, red flag 2. Sorry, bro. This is gonna end badly.
It's
We
gonna
already
end.
know.
The rope stopped.
Oh no.
The forklift and Bernie was caught in the middle.
Oh man. I could imagine you're squeezing so much that it actually crushes the insides. It is kind of classic, as I always say, blood squirting out of the mouth immediately. Airway versus intestines. It could happen, but it's got to go back up through the stomach. But okay, I'll give it to him. That is really strong rope.
Oh my god.
That's awful. Oh man. I was about to say, like, well, at least they didn't show him ripped in half from the rope, but They did.
A sausage intestine.
We're seeing what appears to be intestines. Why does it not look right?
Because there's no mesentery holding it all together.
Don't you think the rope would rip more? I guess not. I don't know the tensile strength of rope.
Is that what it's called?
Tensile strength? Tensile? Tensile. How would you die from this? You'd have to bleed out.
There's a lot of the red stuff.
Besides all the small blood vessels, you have the aorta that comes down and it's still pretty big in the abdomen. It's a little bit smaller as you go past the kidneys.
Dugan's latest job? He was hired to steal computer files for a rival software company.
Hey, sir. That's a closet, sir.
Sir, that's a closet. Come out of the closet.
We gotta come out of the closet. Oh my God.
What is down there? Oh my gosh.
I lived in an apartment once where we had a trash chute.
We lived in that building together.
Yeah. No, I was talking about one before then. That one as well. Okay.
And that brings us back where we
It's
started.
good.
Oh.
This can't be good.
When people meet their end, it's a little bit stressful to even see. But you don't have to lose sleep over it. Definitely try Do Not Disturb by Life Happens. Plus, there's a special discount code for you, my audience of Dr. ER. Be ready 15% off. Check it out, lifehappens.com. We're also on Amazon.
Dugan was about to go from ex-spook to ex-out.
Is that a thing?
I feel like you would need somebody there managing the fire and the flame.
It's enclosed and maybe it's on a timer. It'll be relatively quick, painful as hell to start out with because burns are awful and painful. As you suffer, then you're gonna slowly close off your airway, continue to be in pain, typically pass out, continue to get cooked.
Gardening was her passion, and everything she touched would grow.
Oh, cut to Creeper Man.
Creeper.
That's why when a neighbor strolled by pushing his bike with a flat tire, she was all eyes. It wasn't his tire that got
Oh my gosh! Come on!
Come on!
And this is exactly how I met Jordan.
She wondered what effect her green thumb would have on something like that.
What's up?
She looked around to see if any of her veggies could be of help.
Stop it! You would not be surprised the amount of produce people use that doesn't have a flange or a string attached that's stuck in orifices that are typically used for exits.
Well, isn't the body negative pressure where once it goes up certain, like, yeah.
Patty worked her zucchini like a pro, but lying in wait was a dirty hoe.
Okay, he is a poet.
Remember one of our first dates, like official dates, we went to the Getty Museum?
Yeah!
And there was a painting of a man and his hoe. And we got yelled at because we were too close to the picture.
I made Jordan take a photo with it
Yeah.
because I thought it was funny.
Okay. Oh, man. So it got stuck in the throat, into the airway, can't breathe, blocking even the nasal passage.
Plants need water. Patty needs air.
People can typically probably hold their breath for like 30 seconds to a minute. Passing out after doesn't necessarily mean you're croaking. Typically, you still have some oxygen saturation going on in your tissues.
She dropped to the ground, dead from suffocation.
Suffocation!
Are you choking? Universal sign of choking. Somebody commented like, well, they can't say yes. You're looking for a head nod, yes or no?
Yeah. I just hope that her date wasn't the one that found her.
Oh, that would be awful.
Imagine.
In trouble, Roy.
Oh, geez, of course, electrical. They're wearing their hard hats. Where's your hard hat? If heavy machinery is going to hit you on the head, is a hard hat really going to help that much? Probably not. It still causes a massive amount of brain trauma, skull fractures, and pieces of brain. It's good for minor injuries, obviously not for big major. Oh my gosh, that would have hurt significantly. Oh, why is he bleeding?
Oh my goodness.
Puncture wound right through the soft tissue underneath your mandible here. Could that actually happen? Yes.
Yes.
Would it necessarily kill you? Unless it goes directly through your brain. Not necessarily, actually. We see a lot of people who get these type of soft injuries through the mouth, through the hard palate, maybe into your sinuses. Oh my gosh. That went right through the front part of your brain.
Oh no, my brains.
Now, this will cause significant amount of bleeding, brain trauma, and will eventually kill you. But instantaneously, probably not.
Did you feel that? What? Something's wrong.
Oh. Sometimes we have that feeling inside of our bodies, our intuition that something's not right.
I got a bad feeling about this.
Typically, it's your own warning sign, especially if you don't have a history of significant amount of anxiety or panic attacks. You know, you should listen to it, just something to be aware of. Oh my gosh. You can see all the rebarb and concrete just like disintegrating after just one missed move. Interesting. Oh, come on. Come on! They're showing us what appears to be the classic intestines coming out. Remember, they're attached by the mesentery, so they're not one big string. They're actually attached to each other, and they're overlaid by the omentum. Oh my gosh. Scalding injury. You probably even burn off your eyes at that point. We do treat people who have burns that bad to where they're having these horrible second, third degree burns. When it gets to the head and neck area, you get really worried about constriction of your airway or swelling of your airway. Oh gosh. Oh, oh man.
Oh man.
Right through the base of the skull, the big hole where the spinal cord comes out, the foramen magnum probably just severed the spinal cord and straight through the face because it's low, right? So it could go through the cerebellum, which is that lower part of the brain. Oh my gosh!
My God.
Not cases that I would see come to the emergency department because they're pronounced on scene. We do see people that get impaled with different objects and definitely want to shorten them. Typically they're taken out either in the emergency department or in the operating room, but a surgeon needs to be involved. How much stuff is stored up there? Never-ending shelf of stuff. We see people come to the emergency department where mirrors fall on people, TVs fall on individuals, big boxes, and they get a head injury. You can bleed out and die. You can get intracranial bleeding, fractures, post-concussive syndrome that can last years. Holy cow. Oh my God. A nail gun that is still attached to the air compressor without a safety mechanism. It can go pretty far and deep, but man, that's pretty far through bone. Watching and treating injuries like this can be a little stressful, and that's part of the reason that I helped formulate something called Chillax. It's a supplement for occasional stress support. Check it out at lifehappens.com and on Amazon. Oh, bam! I wasn't expecting a screw into the foot. Ouch. Rusty screw. Hopefully the tetanus shot is up to date. No, I'm just kidding. Tetanus. Doesn't necessarily cause tetanus, but it's just something that we worry about. Depending on where that landed, it could go straight into the bone and get stuck. It could just go into the soft tissue, but it hurts a lot. The skin is very thick on the bottom, so once it actually goes in, it's actually quite painful. Okay, just fall down. Okay, okay. Oh, sorry to laugh. That is so wrong. Thoracic hyperextension and then massive amounts of lumbar extension as well. That's why those legs are all the way back, but you just see bones popping out everywhere. So she probably snapped her neck. Oh! Whew. Oh my gosh. You got so lucky. When you fall from great heights and you land on your feet, ouch. You can land on your heels. You can snap your calcaneus, which is your heel bone. If anybody's landed on their feet and they complain of lower back pain, you got to get x-rays of the whole spinal column because you can have a compression fracture at any level. Oh my gosh. He landed on glass, and so you can have the glass of shards in your back, cause a lot of lacerations, injury. Sometimes it gets stuck in there and we can't see them to get them out. Sometimes you can see it on an x-ray, and then a lot of times if we can't get it out, they will come out like a splinter. Yep. Oh. Wow. Rupture of the eye, but behind the eye is obviously your brain. The skull is pretty thick in the frontal area, but behind the eye, it's a lot thinner.
Could you be a little quieter with that thing, please?
Yeah, sure. I'll just put it on quiet mode.
That would be good.
Oh my God, he killed her. Oh. Oh my gosh. I don't know the mechanism of airbags, but they do come out with massive amounts of force. People come to the emergency department often after car accidents. They do get concussions from the airbags. They get burns from the chemicals of the explosion of that airbag. But again, the airbag is saving your life. Oh man. Wow. The amount of force that it takes for barbed wire to rip somebody in half so cleanly. We do see organs. The classic intestines, yes. But you would see at the top part here that this is potentially the liver and potentially the kidney. Oh, it could be the stomach as well. That was actually quite impressive.
I'm Coyote Peterson, and I'm about to enter the spike zone.
What? Come on.
Come on!
This one was complicated.
Are you allowed to have the fish out of water, though?
Yes.
Okay.
For a short amount of time.
Oh. Here we go.
See what happens.
3.
Ow! When these fish are defending themselves against predators, it's probably something that's come in and is biting it, so those spines go in. Right. There's gonna be more impact. But think about it. How difficult is it to force something to penetrate your skin?
It actually takes a lot of effort, even when we do these really super sharp needles.
Yeah.
It's actually really not that bad.
You have a significant amount of veins on your hands, so you could potentially puncture and get that sting directly into a vein.
The amount of pain that I was going through is probably a fraction of the amount of venom that could possibly be injected.
You see where the spines went in? There, and I think his body kind of turned.
So do the spines ever come out and like stay in?
No, it's not like quills of a porcupine.
Probably went into like the subcutaneous, just underneath the skin. Unlikely into the muscle, but it could. And then now you're experiencing that toxin that it has.
Hold on a second.
These fish are incredibly resilient. It's worth noting there's a massive invasive species in the United States. And fortunately, the population is kind of getting under control. They have these lionfish hunting tournaments.
It's kind of coming in a wave. All right, I'm gonna take this thing off of my wrist.
Now that's probably a thing that a doctor would suggest, right?
Yep.
Get this leather thing off.
Correct. We don't like anything that constricts. So we have had discussions before where it's like, hey, rings, get them off your hands. Make sure they're not on there because your hands can swell.
And what you don't want to do is cut off the circulation.
See, look at
Well, yeah,
that.
you are a
practically
professional.
a doctor.
That's
you know?
right. That's right.
Feel my forearm, dude. That's like instant. Squeeze under
Getting
here.
tense. Do you feel like it's like getting hard and swollen?
That's what she said.
Could be related to you wearing bracelets from the sun, or if it's starting to swell, it actually push on that and actually blanch out your skin.
I felt the spikes go in.
See, there in the slow motion, you can kind of see a force that I had to get.
Yeah, it was like a karate chop.
You know when skin pops.
Oh, yeah.
It's weird. It's like almost like saran wrap.
That's kind of like a pinprick. Big pin, but a pinprick nonetheless. I kind of got up and said, that's not that bad.
Somebody came to the emergency department. Make sure your vital signs, which heart rate, blood pressure, all that stuff, are just fine. Make sure you're not having an allergic reaction or anaphylactic reaction. And then thereafter, it's just pain management. Typically, we start out with anti-inflammatories, and then if that's not sufficient, we can go to an opiate.
Okay, it's getting worse, guys. It's getting worse, and I'm getting dizzy.
And it does. It escalates. And that's the thing that I've noticed with a lot of different venoms that are specifically marine venom begins to build.
For your scale of 1 to 10, where would it fall for you?
I may have noted it in the episode where I felt, so I can't remember, so I don't want to contradict myself, but memory looking back on this all those years ago, I would say it was probably in the vicinity of a 5 or a 6.
I'm Coyote Peterson, and I'm about to enter the sting zone with the cow killer.
What a beast.
Is it a cow killer because it kills cows?
It's technically a wingless wasp. The old-timey tales would say it could kill a cow because of how bad the sting hurts, hence the name cow killer. It would not kill a cow.
Oh, okay, trying to sting you.
There's where the purchase happened, right there.
That happened so fast.
So fast, but you can see how thin the gauge is of that stinger
Right.
when you think about that.
Yeah.
I mean,
you could see it just like testing the waters.
well, it was just kind of missing. I don't think it was so much gauging as it was like, where am I gonna actually hit with?
You were instantly like, oh, that doesn't feel good, immediately.
Oh, it's immediate, yeah.
Wow.
Oh my gosh, guys, this is super bad.
Describing is super bad. Doctors always ask, please describe it. And you're like, it hurts.
Well, it hurts.
Is it burning, pressure, sharp stabbing? Is it throbbing?
The venom is designed to react immediately. So it is a searing pain. And this species specifically is more robust.
Hold on, I gotta try to control my heart rate.
These guys are hanging out on the ground. People mostly get bitten just because they're walking around and they don't see them.
That's a great question. So when you disturb a wasp nest, it's usually something trying to defend its own. Because these little velvet ants are solitary, they're on the ground, all interactions happen with people accidentally stepping on them.
It feels like I'm getting stung over and over again.
Still continuous feeling?
Yeah, and that's the one thing that a lot of people will tell you about stings is like there is then that secondary effect, and I'm assuming that is just the neurotoxic
Correct,
properties,
it's working.
which I now know more about.
Is that all around the sting is tingling like these little tiny pincushion needles going tss, 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 tss.
That electrical impulse, I guess my question to you as the doctor, is that the neurotoxic properties?
That is your neurotoxin property, is messing with your nerves. You're also dealing with the pulsatile component of it, your blood pressure, heart rate, adding into it.
There's all these little red dots forming, and I'm assuming that is where the venom is spreading.
1 to 10, where would you put it?
I would probably put this towards the 7.
Got it.
But the good thing about this is that it's a pain that doesn't last exceptionally long.
I'm Coyote Peterson.
Look at this shaved,
Clean
young,
shaven.
strapped man.
And I'm about to take on the Bee Beard Challenge.
You know that thing that was on my chin?
Yeah, I
is
saw
a
it. It's not your
queen
hair.
Pheromone. That
Right.
is a pheromone
Okay.
stick with the scent of a queen bee.
How you feeling now, Coyote?
It's a lot of bees.
Have you been stung yet?
No stings yet.
So the shininess that you see on my face, that's Vaseline to try to prevent the bees from wanting to go up into my eyes. We had Vaseline in my ears and on my nose. Chris, our amazing bee expert, said I would be completely fine.
That is a lot of bees. I would not be comfortable.
Ah, my neck is getting stung again.
So you're saying you're getting stung as this is happening?
Yeah, I got stung for the first time like twice very early on.
Okay.
And that was very unusual.
So what is Coyote Peterson?
That is a stinger lodged into my lip.
Yep.
And like that's a very sensitive part of the body.
Yes.
As I'm sure you
Oh,
can
and it'll
attest.
swell up real fast.
Yeah.
Yes.
Down the lip again. Oh, no.
The lips are just almost to your mucosal membrane on the inside, and it's like that transition. Once you start getting around the face, we get worried because of swelling and then your airway, and it gets very concerning. And don't move. He's gonna take it off. Literally, you can see the stinger.
Yes.
He's grabbing it with his fingers. That bulb still has venom in it, so he is
The
squeezing
venom
it.
sac.
Yeah, so now he's going to squeeze it to try to get it out of you, and it's going to inject more venom into you.
Probably a good chance.
Yes. I always tell my patients the appropriate way is to use tweezers as close as you can. Don't squeeze the bulb to pull it out. You can use a credit card or any type of card to slide across. Obviously, you can use duct tape. Certain things you can't get a good grasp on, you can actually use like Elmer's glue.
Oh, same spot.
Is somebody giggling behind you?
That's Mark in the background there. Everybody was like starting to
God.
laugh once they're like, man.
Okay.
There I got stung again. On
Wow,
the
they're going after your lip.
Well, here's the thing. Once a single bee stings, it is going into defense mode. So it's releasing a pheromone that's saying, this is a thing that we're targeting. Get them.
Oh, but you've almost got it. You're so close.
Oh my gosh, that's gonna hurt. Yes, it is.
You got it. Power through.
Woof.
You've got this. You already got.
At that point, it becomes a lot scarier when you've got your eyes closed.
Your proprioception now is going to be off. So,
Yeah.
you know, where you are in the world, you're going to start feeling dizzy. You're going to feel like you're going to falling over. So, you're good.
My eyes, my eye. I'm getting stung a lot.
What you're not seeing
Is the amount.
is that the amount of times that I started getting stung from the pile of bees that was on my face.
I'm covered in bees.
Actually, literally, it like drew blood.
Yeah, it like got blood
Yeah.
to the surface. You just got stung like 40 times in the face by honeybees.
40.
I would probably say, Coyote, let's give you an EpiPen so this doesn't progress more. Do you typically have EpiPens on set so you carry them with?
Oh, you
literally
right now, as a matter of fact.
You carry it with you wherever you go now, just to make sure. You never know.
The B-beard is
Oh my gosh! Holy cow! People pay good money for that.
Right?
Oh
That's
my
what you
gosh.
call lip injections.
Yes. 1 to 10 on a pain. Where would it be for you?
I would probably say a 7, but the thing is, once that pain wears off, it wears off a bit more quickly than some of the other venoms that I've taken.
Got it.
I'm Coyote Peterson, and I'm about to enter the nettle zone with the Gimpy.
What the heck is a gimpy? It's a Gumby? No.
Trust me, this is no Gumby. One of the top 3 most painful experiences I've been through.
With a leaf?
In Australia.
Okay.
So you're fine here in the United States.
Yeah. That is a big leaf.
It is a big leaf. Believe it or not, somebody once wiped their butt with that leaf. So this is what we would consider a nettling. Imagine shards of fiberglass, if you will, or little tiny hypodermic needles. So if you looked at this under a macro lens, it would look like a bunch of snake fangs.
Holy cow.
Instantaneous.
All right, you can see where the redness is starting to set in there.
So redness is basically your inflammatory markers, maybe a neurotoxin again that might be going on here.
Dude, the pain receptors for this specifically, so it's considered the most painful stinging plant in the world.
Wow.
On fire and being electrocuted at the same point is exactly what this feels like.
Yeah, that burn.
And it is continuing to build.
This is the kind of pain you think you may be better off cutting off your arm than risking this going
That's
further.
that bad.
It is that bad.
Now, when you think about it building and getting worse, I'm about 1.5 minutes in.
This lasts for a considerable amount of time, 24 hours of really intense pain, but then I continue to have pain and ultimately what I believe is nerve damage for 6 months after the fact.
My whole left side is like, oh, so uncomfortable. All the way up my arm, into my shoulder, and into my chest and my lymph nodes.
Your lymph node is like, you think about your lymphatic system as train tracks.
Yeah.
And the lymph nodes are the train stations. So it's where everybody gathers. And when that starts swelling, especially in this type of reaction, they also get really painful.
Yeah.
And so it's hurt, and you have a lot in your armpit, a lot in your neck. Oh. Oh my gosh, what the heck? Lacerated puncture wounds to your ankle, lower extremity. Painful as heck. It's gonna cause a lot of disturbance to your ability to run around, use it. Ow! Your lower extremity, below your knee, you have your calf muscle, the gastrocnemius, and then underneath that is your soleus. They all connect into your Achilles tendon. What is this massive syringe? And it's got a white, creamy material in it. The only white-ish material that we see that we potentially would inject into another human is actually propofol, which is a sedative. I always remember it's white because there's a soy component to it. All right, so now awake. Oh my gosh. Clowns, they kind of freak me out. Oh my gosh. Cutting a leg, amputation, it's gonna take a lot of work. Now, with the saw, can you cut through the soft tissue pretty easily? Sure. That's not how they do it at the hospital. You're actually going to cut and dissect with something called a bovie knife, and then when you hit major blood vessels, you're going to either cauterize them if they're small enough, or you'll tie them off. Oi. Oi! Taking a 2x4 to somebody's head, swinging it like that, it's going to do a lot of damage to somebody. You can cause a rupture of the eardrum. You can cause a skull fracture. Getting hit on the side of the head. Always worry about the middle meningeal artery, which sits on the side of your head. If that blood vessel ruptures open, it can cause an epidural hematoma, causing significant amount of neurologic problems. Significant amount of bleeding to the mouth. The mouth bleeds so much when there's facial injuries. The teeth typically cut, the gums. You might actually bite your own tongue. Come on. Come on! Getting shot in the abdomen, if that's the case. Usually if they come to the hospital, that means exploratory laparotomy to see if there's holes, defects, or anything that needs to be sewn up. Oh, jeez. Just a clown walking around, blood all over themselves. In my career, I've seen multiple injuries relating to a hammer.
A hammer.
You have to have enough force to break through the very thick frontal part of your skull, smash into your frontal lobes, causing bleeding, which would then cause you to pass away. Well, okay. I'd say the same thing and get the heck out of there. To be honest, sometimes watching scary movies like this, it's hard to fall asleep afterwards. That's where Do Not Disturb comes into play, to help you relax and drift into a restful sleep. You can find Do Not Disturb on lifehappens.com or on Amazon. Oh my gosh, we got a knife. Oh! Knife wounds to people's head sometimes can go in, but a lot of times they will bounce off. If there's enough force and a sharp enough blade, yes, you potentially can get into the bone and into the brain itself. The amount of blood that we see pouring out of here. Unless you actually hit a major blood vessel, it won't bleed that much until you pull it out and allow it to seep out a lot more. And most of the time it's venous blood. A lot of the red stuff all over himself. When it comes to the face, you gotta be really careful about bloodborne diseases. There's a reason why we wear scrubs and we don't wear nice clothes. It's because of the potential of getting pathogens on them as well as blood. It's like fire starter. Fire starter. Oh! Pop a hole. Pop a hole. Suffocation happening. Suffocation! Panicking, trying to get it off, increases cellular demand of your oxygen. So you're going to go through your oxygen a little bit faster of what you have. There you go. There you go. Rusty, nasty nail. We always ask about tetanus, not just because it's rust, but because of where it's sitting. We don't want anybody to have tetanus. It causes horrible muscle spasms that we don't see very often because of vaccinations. A rusty nail. That is a big ow, trauma to the foot through a shoe. We usually see through the bottom of a shoe. Typically, it doesn't leave a big, massive hole. The depth of it typically doesn't go into the bone. A lot of times, we still will get an x-ray just to make sure. You worry about Pseudomonas. It's an infection that could be inoculated into the tissue via the foam of the shoe. More common with like sneakers or sandals, but this one through the top. There's not as much soft tissue there, so right into the bones, definitely broke some bones. Oh my gosh. Oh! Broken jaw, potentially. A lot of times jaws break in two places. You'll break in one area and then on the other side it'll have another fracture, and that's just because of the energy. Head injury, even if your jaw is fractured, the things that we worry about outside of your teeth is a cervical fracture, or the fracture related to your neck because of the torque, and then obviously potential of a brain injury. Oh! Could that actually have injured somebody so badly that they succumb to the injury? Maybe. Or you can just cause fractures. You can cause fractures of the face, the jaw, broken teeth, some facial lacerations, skull fractures. But if your spinal cord is still intact and you haven't destroyed a ton of the brain tissue with significant bleeding, you might just be knocked unconscious. Compressing down on the neck. There's multiple ways to cause injury. First off is the trachea, right? You're worrying about fracturing the cartilage of the neck, causing a collapse of the airway, or enough trauma to the area that you cause enough swelling to the soft tissue. You have the major vessels of your neck, your carotid artery and jugular veins. When they're collapsed, it can cause major issues. If it continues, lack of oxygen due to lack of getting blood up there will occur. Brain tissue death will eventually occur. Oh! Massive trauma to the right eye. Interestingly enough, you wouldn't see that much red stuff. If you cut the upper eyelid, yes, you'll have some bleeding, but the eyeball itself has some blood vessels, but it's mostly fluid within the eye. Ow! Likely will lead to a permanent eye injury. They'll probably enucleate the eye and get rid of it, unfortunately, and you will be stuck with just one eye.
There are two teams, Team Red
Team Black. Whichever team survives the longest in this insane asylum.
Insane asylum, it's an outdated term. We have psychiatric hospitals and we have mental health institutions.
By the way, they can't use their arms. They're all wrapped up. Whichever team survives the longest gets 10 grand.
These jackets that they're wearing, again, are another outdated device. It's basically called a straight jacket.
Straight jacket.
But it's a long sleeve jacket coat that can actually buckle in the back, and it's to keep somebody's arms down and it's to restrain them.
I'm gonna turn the megaphone on siren mode and throw it in there because I have no way of turning it off.
Oh my gosh, that is awful. We should be able to use our toes and our feet just as well as our hands. It's just we've evolved to not. There are some people out there that have a significant amount of dexterity relating to their toes and could probably manipulate this to get it off.
They turned it off. Hey, you weren't supposed to be able to turn it off.
There you go, perfect.
I just had them go and buy some Twizzlers to feed them as a nutritious little snack.
Twizzler as a nutritious snack? Not so much. You basically would want something that's well balanced and has a lot of nutrients in it, like a balance of carbs, fat, and proteins. What's my favorite snack or my go-to snack? Is probably a protein bar.
So I'm just gonna go and like sneak it through the little hole.
Hey, what are you doing?
Nothing.
Typically, if you're eating sugary carbs things, it might actually make you more hungry, just something to be aware of.
It's time for us to feed them their first ration. This and 3 crackers.
We got peanut butter and saltine crackers. Saltine crackers are just basically like dry crackers with some salt on them, giving you some fats, proteins, carbs, a little bit of sodium, but then the issue ends up being with the salt of the crackers, increase the risk of starting to become a little dehydrated.
So we were letting Chandler poop and
I tore my labrum and my shoulder like popped out of socket and it really hurts.
Oh, wow. Okay, interesting. Injury to the shoulder joint itself. Labrum is part of this, and so his shoulder can easily go in and out of sockets.
How do we deal with the medical injury? All right, so Chandler's out. So Chandler, you go get your shoulder taken care of. It sucks, but nothing we can do about it.
There's not much to do. If you have a shoulder that is going in and out, in and out, in and out, since he can put it back into place, it just needs to be stabilized and immobilized in that position for a little while.
The $10,000 prize is still here. Whoever steps out next doesn't get anything, and the other 2 get 5 grand each.
My ears hurt.
So now they just changed the rules a little bit. Why is he taking off his straitjacket?
The doctors have said that they're pretty sure that I've blown either one or both of my eardrums, because my eardrums are full of pus and stuff like that, and I have an infection. These are the winners. All right. Adios.
There are about 3 different types of ear infections that we commonly discuss. There's something called otitis media, which is basically the eardrum is infected. Then you have otitis externa, which is the infection of the ear canal. And then you have mastoiditis, which is infection of the bone behind the ear.
I am not eating any food for the next 30 days.
Wait, won't you be hungry?
This is what I currently look like, and I weigh 220 pounds.
Wow.
This was the hardest I've ever pushed my body in my entire life.
You can go without eating for 30 days. There was actually a gentleman, I believe in the UK, that went over a year without eating any food. He just drank fluids and had vitamins actually and supplements. And it was observed by doctors and he did fine.
I had a whole team of doctors watching me every single day.
I don't know if you guys saw me and Coyote Peterson, but I used similar machines on him if you ever guys want to check out that video.
And if I for any reason eat food in the next 30 days, Chris, you get to shave my head. No. I'm laying in bed about to go to sleep and it feels weird not having a snack before bed.
You should definitely have a window of a few hours of no food before going to bed. And it just has to do with your ability to get good rest, because if you eat before going to bed, you're just asking your body to continue to use its machinery and energy.
The only thing going in my mouth for the next 28 days is water. Let's go see how much weight I've lost. To be honest, I probably weigh basically the same.
Should, yep.
Yeah, like I said.
Typically in a 24-hour period of time, individuals normally when they eat or drink can fluctuate, anywhere between 1 pound to even 5 pounds. It just depends on the individual.
A lot of people say that days 3 through 6 are the hardest, but for the most part, I feel fine. I'm just a little sluggish and I just feel tired.
I've fasted many times in my life, anywhere from 16 hours, 18 hours to 5 days of fasting. Typically around day 3, you actually start feeling pretty good and you start having some interesting clarity, energy. I was even just checking my blood sugars and was doing fine.
Taking my first poop since I started fasting.
So a lot of people come into the emergency department and describe to me that they can't poop because they haven't eaten. Poop isn't just made of food. Your poop is made of like your byproducts of your body's processes. So you still will make poop.
So I'm down 2.5 pounds in the last day. That's actually pretty crazy. But it does make sense because I took a giant poop this morning.
There you go.
It's the morning and I woke up with a headache.
So yeah, so headaches do happen. Say somebody drinks coffee a lot, you can have the withdrawal headache from caffeine. And then obviously sometimes relating to either dehydration from not eating or this switch in metabolism.
Day number 6, and for whatever reason, I'm feeling really good.
See, there you go. So for him, day number 6 is when he started feeling really good, which is fantastic.
The boys sent me a random DM saying they're playing basketball. Probably a horrible idea, but screw it.
I didn't realize how weak I was from not eating. But despite that, I still managed to score a little.
So your body's just a little bit more sluggish, which is a normal effect because also your body's trying to tell you like, hey, we don't have a lot of reserves from an energy standpoint, so it wants you kind of just to slow down. It's kind of our own body's regulatory system.
From with Gordon Ramsay from one of our videos, he has informed me he wants to cook me something for his channel.
Beautiful.
Oh my gosh.
Breakfast sandwich,
I
young
hate
man,
this.
come in. At least take a bite.
Oh, I love it. They're trying to like tempt him to eat some food. A good way to overcome like hunger, drink a lot of water. The big thing is you just want to make sure you're not drinking so much water that you're then diluting out your electrolytes.
I guess I'll take one bite, and I have to spit it out technically because of refeeding syndrome, but I still want to just taste it.
So you're breaking the fast?
I'm gonna break the fast.
Oh!
It's supposed to be sloppy, rich, delicious.
So eating, chewing
Best
it.
thing I've ever tasted.
But he's gonna spit it out. So you're breaking it down a little bit. You're maybe absorbing a tiny bit of it. Do you guys want to see a video of me doing a certain number of days fasted? Let me know in the comments.
But you can't just have an influx of carbs after not eating for 14 days.
Happy with that?
I am. I was very happy. Thank you.
Right.
I feel energized just having that in me. Bro, after 14 days.
There you have it. This jerk is gonna make me shave my head. Let's go do it.
All right, so he lost, so he had to shave his head. That's pretty funny. But 14 days is really good. When you break the fast, you need to do it slowly. You just don't want abdominal pain. You may end up having vomiting, nausea, diarrhea, and obviously some pain. So please don't do that. You need to do it nice and slow.
Nice and slow. Trust Chris with the razor anymore, so this is my barber finishing up. And this is the only time you're gonna see me like this.
Fasting, you just have to be aware of why you're doing it. What are you doing it for? People do fast all the time and have used it for centuries, from religious, from dietary, weight management. And if you're going to try to do something like this, make sure that you have a healthcare provider that's going to be supervising you.
I'm going to attempt to sit underwater for 24 hours straight.
Oy.
We put a box underwater and we filled said box with air.
Cool.
And my goal is to sit inside said box, which is underwater, for 24 hours.
He's in a wetsuit to help with temperature regulation. That's good. You're definitely gonna get very like waterlogged.
Now normally this wouldn't be safe, but I have this tube right here. This tube is going to be constantly feeding me oxygen. So that's why I won't suffocate, because this tube right here is going to be pumping oxygen into here the entire time.
My concern would be he's exhaling CO2. Is he pumping enough oxygen in to displace the CO2 that he is breathing out, so that way he's not rebreathing all that CO2?
For whatever reason, I'm not getting air like I used to.
What are the effects of somebody who having high amounts of CO2? You actually get confused, you get altered, you get sleepy. And then as somebody gets sleepy, then they changes their respiratory drive and it can actually slowly make you go into respiratory failure.
You can't really see it, but dude, my hands are all shriveled up. Like, I don't know if you can tell, but that's not normally what my hands look like.
I literally get the wrinkling of my hands and my feet after like 10 minutes in the water. When you're exposed to fluids for a long time, onto your skin, it gets soft, it increases the risk of injury as well as infection to these areas.
I hate to disappoint you guys, but I randomly started feeling extremely sick while sitting underwater and I had to come out. Like, I just had this strong urge to throw up. I think it's because the water was constantly moving. I was just getting really seasick under there.
He's saying it's the movement of the water. Definitely could make you feel nauseous. The other component is if he's starting to have some change in his gases relating to maybe retaining a little bit more CO2 and having less oxygen, that could also make you feel nauseous as well.
If you don't know, a marathon is 26 miles.
It's 26.2 miles.
And today, with no prior training, we're going to attempt it with the world's largest pair of shoes.
Oh my gosh, that's so dangerous. I mean, it's not so dangerous. It is dangerous in the sense of increase the risk of falling, breaking an ankle, twisting an ankle, spraining an ankle.
Ankles all the way.
Snapping a tibia. A lot of different injuries could occur by tripping over your feet.
Look at the difference there. Yeah, they already do.
What's gonna hurt is your anterior tibialis, so the muscle that runs right next to your shin bone on the lateral side, the outer side.
This is 26 miles, which is a lot.
People train for these for like a long time. I got 4 hours of sleep and I ate a hot dog.
Each of these shoes weighs 5 pounds.
Oh my gosh, that's another problem. Oof. Typically a normal shoe that you would use in general, maybe a half a pound for like racing, maybe even a little less.
These shoes suck. They hurt my ankles, my feet. 26 miles doing this.
Just watching this makes my own ankles hurt. When you need to recover, some of the best ways to do this is actually get really good sleep. I developed the sleep supplement called Do Not Disturb. Check out this product on lifehappens.com as well as on Amazon.
I need another break, dude. My hips are killing me.
Interesting. Why would his hips be killing him? Because he's actually lifting with his hip flexors, those muscles in the front. So he's using different parts of his body that he wouldn't normally use as much and with as much weight on them.
This right here is the pathway to the finish line. It's not as epic as a normal finish line, and that's because the marathon closed 2 days ago.
How many of you out there have ever done a marathon? Let me know in the comments. I've done a half a marathon, 13.1 miles.
The marathon.
The what?
The marathon?
My wife wants to torture me. She wants me to know if you guys want to know if I should do a video of me training to do a marathon and completing a marathon. Nice. Yeah. First off, super cool. It is Ryan Reynolds. I think this is Wade Wilson. For everybody out there who knows more than me, please let me know. Oh man, stab wound right to the flank. Classic marks, open wound, really clean. Did a good job depicting it here. You're hitting it below the ribs. You're hitting mostly probably your colon, maybe some of the vessels coming down, as well as maybe your ureter, which comes down from the kidney down to your bladder. What? I wish I had the technology to be able to heal wounds like this. Typically, if you came into the emergency department and I needed to fix you, obviously we're gonna do some imaging first to make sure that there is nothing injured on the inside. If it's just a superficial wound, a couple sutures to close that up. Whoa, super cool. What are we looking at? Really cool anatomy, right? We've seen the heart beating, we see the lungs underneath the rib cage, and they did such a good job of showing that the rib cage does not go all the way to the sternum, because as those ribs stop, that's where cartilage takes into effect, and the cartilage fills that space.
I saw you dying in the room like this with your heart.
Just can't leave her with those freaks and killers, Uke. I'm the only chance she's got. Not with that thing inside me.
You're going to die, Logan.
Maybe that's okay.
Oh
No,
my
listen to me,
gosh.
Logan.
Interestingly, he's going from a subxiphoid angle. There are procedures that we need to do in the emergency department where we need to stick needles into the pericardial sac. We do a subxiphoid approach angled up towards your left shoulder.
No, stop! Logan!
You're not gonna want to watch this part.
No, listen to me, please. No!
Okay, so you gotta be really careful, because if you're using your hand, which sometimes we do when we do thoracotomies and we open somebody's chest open, you gotta make sure that you're not gonna slice your hand on any of the ribs, because those ribs are super sharp. And it's super cool because you see his fingers, and his fingers are phalanx is what we call them. See that like image? It's actually very similar to the C-arms that we use in the hospital, where you do basically continuous x-rays. Stop it. That's crazy cool. I would be like crushing that in my hand if that was me. Oh, now is he going into cardiac arrest? Oh, asystole, flatline. Not a good rhythm. Why is that not a good rhythm? It's not a shockable rhythm. You cannot use those defibrillator pads to shock somebody out of asystole.
Today, you're going to witness medical history.
Oh, Stryker.
About to begin bonding adamantium.
Adamantium. Oh my gosh, super cool. Logan, Wolverine here, was able to use his bones before as his claws. Where are these bones in the forearm? Are they his ulna and radius? It could be his metacarpals, but we have 4 of those. Blood pressure on the bottom, 120 over 65. That's pretty calm for somebody like chilling, about to go underwater and be stabbed with some needles. And then same with the heart rate of 62. Oh, now they'll see the change. There we go. So they're doing this to him, right? If anybody doesn't realize, they're injecting metal into his body to fuse with his skeleton so he can be that much awesomer.
That's why he had to volunteer.
Heart rate 190.
Heart rate 190. That's pretty darn good for somebody his age. There is a calculation of like maximum like heart rate based on, you know, your age.
Heart rate well beyond maximum.
Blood pressure. 260 over 180 and rise.
So it's really interesting. They're saying 260 over 180. When we see that, typically your heart rate's not that high. Usually they go opposite each other. Now, yes, could it happen to a point because due to a significant amount of pain, the pressure is that high? Yes, but also blood pressures can be falsely elevated if you're contracting against the blood pressure cuff that is on your arm.
You broke the machine.
Heart rate over 300, yeah. Have I ever seen an individual with a heart rate over 300? I have not. We do see the radius and the ulna, but then he has these 3 other bones, which we do not have. We don't have Logan's restorative healing powers, but did you know during deep sleep, your own body heals tissues, rebuilds muscles? So if you want to improve sleep, try Do Not Disturb on lifehappens.com and on Amazon. Ooh. Oh, rebarb stab to the back. Are you kidding me? Obviously, I would tell you don't pull it out, but it's also connected to a massive piece of concrete. So this person, if it wasn't Wolverine, would be trapped underneath this with all that weight, and it actually might fall over and rip the innards out of you, so to speak. Or this would happen. Oh my gosh. So we've actually had individuals come into the emergency department being impaled with rebarb, and typically we end up stabilizing it, making it shorter, so to speak, so we can actually get some imaging of it. We can't get an MRI because that means that metal's flying everywhere, but we can get a CT scan.
So much for being a survivor.
I feel like if he really wanted to hurt him, he would just expand all that metal really fast and rip him to shreds, but he doesn't. He throws them out. Oh my gosh. Maybe not able to breathe. He's going to drown. There are a couple things that we talk about when it comes to water. You can have your initial response where your vocal cords close up due to the shock of the water and can cause what's called dry drowning, so to speak. But then obviously you have your wet drowning where you actually get fluid into your lungs. Holy smokes, literally.
Literally?
A lot of these burns that you see on Wolverine are deep 2nd and 3rd degree burns. We don't see any 4th degree burns here because we don't see any significant subcutaneous tissue and into the muscles and bones. But we see all the skin, maybe some fat underneath, but he's able to heal really well. I wish our bodies could do that. That'd be amazing. You worry about airway first. If there was any indication that the flames got into somebody's airway, seeing soot in their mouth, singed nose hairs or face hairs, then you worry about, okay, is the airway going to swell because of the flames that were there and the inflammation? Oh, puncture wounds to the head itself. If it goes into the face, probably is okay. You'll end up getting fractured, but if it goes into the brain through the skull, probably not survivable. Oi. Pretty cool that you can see the bones on the right arm. It's depicted really well, especially at the elbow. You can actually see the ulna and the radius. Gunshot wounds to the head, depending on caliber, distance, and area of the brain hit, could lead to bleeding the brain, traumatic brain injury versus succumbing to the injury. Oi, getting hit in the head with a morning star. Not something that typically comes to the emergency department. We typically will deal with blunt trauma to the head, metal objects, hammers, rebar, baseball bats. We'll end up getting a CT scan of the head, neck, and face, depending on the areas. Okay, direct trauma to the left eye.
Aye.
You're giving a puncture wound to your globe, the eye itself. We get worried about all the fluid coming out of the eye besides the integrity of the structure of the eye. So the ophthalmologist, which is the eye surgeon, needs to evaluate, is there something that's salvageable? Can you still save the eye? Just watching that hurts my hand. All I can think about is broken bone, broken bone, broken bone. Typically when people punch something super hard, they punch with the wrong parts of their hand and they hit with these two knuckles, and these two bones decide to go and snap and cause a boxer's fracture. Oh! Massive blade right through the side of the head, going through the ear. So you already have part of a hole there. But on the other side is all the structures relating to the hearing apparatus as well as our vestibular apparatus. So having to know where we are in space. So you get really dizzy real quick. I always tell you, don't pull it out. Pull it out and now you're gonna have bleeding, a lot of swelling to this area. Doesn't necessarily mean somebody's dead or going to die, but we'll get somebody to come to the hospital. Emergent imaging, we'll likely have to intubate this individual, have a neurosurgeon take a look at them. Oh, malfunction and self-injury. The worst type of self-injury that we do see is accidental discharge of somebody's own handgun, where it's in the inappropriate position and they shoot their own leg or hip or genitals. Yes, this does happen. Explosions. Explodes. Pneumothorax, hemothorax, so lungs can pop open, eardrums might burst, and then you're dealing with the burns thereafter. From an emergency standpoint, burns are pain management control, prevent infection, and then also fluid hydration because you're losing fluids. A lot of destruction happening. We'll see people come in groups to the emergency department. There's something called mass casualty accidents, but we'll just have, big car accident where there's like 4 or 5 people come. And that's when you actually really use your triage system. You're triaging individuals of who needs immediate care, who can wait a little bit, and who potentially is going to succumb to the injury. Whoa. Missing the eye. When people actually have one eye, monocular vision, you'll eventually be able to have better depth perception after the body and brain gets used to it. But at the beginning, your depth perception is going to be a little bit off because you do not have binocular vision. Big injury, laceration to the side of the head. That blade is really long, can go right into the brain tissue. And if it hits deep enough and causes enough bleeding, can cause pressure in the brain, causing brain herniation, or just the trauma to the brain tissue itself. Whoa. After watching the chaos that is Skibidi Toilet, my brain could use a chill pill. That's where Chillax can help to bring back those chill vibes. You can grab Chillax at lifehappens.com or on Amazon and get back that balanced feeling. Ouch. Electrocution to the head. The big things that we worry about cardiovascularly, what is happening? You're having so much impulse of electricity to the heart, it can send your heart into ventricular tachycardia, ventricular fibrillation, and cause you to go pulseless. Whoa, just chilling. It fries your nerves, so your function of the nerves don't work anymore. It will also fry your tissue, causing muscle breakdown, rhabdomyolysis, kidney failure, elevated potassium levels. A lot of bad things happening. Head injury down onto the concrete. We see a lot of injuries that way, not being forced this way, but when people fall, they hit their head. Skull fractures, intracranial bleeding, as well as the soft tissue injuries that we need to repair. What? Did you all just see that move with the blade to the side of the temple? There was the twist.
Twist it.
Twisting it will cause more damage. Please don't do that to each other. Oh my gosh, the knife's still on the side. That knife could be going through the bottom aspect of the frontal lobe, might be missing it, could have caused eye trauma in the back, hitting the muscles and the optic nerve and going straight through. Whoa. The beams here are just high energy, thus causing destruction of the tissue. Energies like the sun has super high heat, crematoriums. We typically don't have this type of energy at the hospital. We do use like cautery as heat to help with different wounds. So surgery, they have the Bowie knife. It's a knife, but it also gets heated up so you can actually cauterize things. Ooh. A lot of head injuries because we have heads in the toilet. Most of these injuries that I see related to head injuries is blunt trauma. We do not see a lot of penetrating trauma outside of gunshot wounds. Most of them are likely fatal and they don't make it to the hospital. Whoa, that reminds me of the mountain from Game of Thrones. It could happen. Not compatible with life, not something that shows up to the emergency department, not something that's even taken by the medical examiner's office. Whoa, oh, we know what's happening here. We get an attempt at good anatomy of cervical spine, the connective tissue, as well as almost bones. So good job for the creators. Oh. Whoa, regeneration here. Actually super cool. I'm just looking at the neck itself. Look at that neck. We're seeing pieces, what it looks like possibly maybe a trachea. That would be really cool versus just bones of the spine in the back. Whoa, run away. All I can see is the hands, right? They're in an interesting position, so I'm assuming they're pushing. We actually do a neurologic test where we force somebody's hand like this, and then if they actually have this tick, it's called asteristics. Nice. Pretty smart. But imagine a massive, heavy box falling on you and your body just bends in half like that, so you snap your vertebrae in half. I've actually literally seen people snap their vertebrae, become paralyzed. Typically, they have to do with like falls from really great heights and landing on an uneven surface. Whoa, go. I've actually seen injuries come to the emergency department from these type of machines, like no joke. What ends up happening is somebody gets caught, maybe a piece of clothing, a piece of equipment, and I've seen people's hands get torn off or fingers ripped off. Oh, no. What have you done? I've never seen anybody die from this, thank goodness, but you have to be really careful with any heavy machinery. Should they have safety measures on there? Yeah, they probably have them, but stuff potentially could still happen. If you lose an appendage, something gets cut off or amputated off, bring it with you. This circumstance, there's nothing potentially to put back. Obviously, if this happens while you're at a job site, get the patient to safety first. Try to stop the bleeding, either tourniquet or a significant amount of pressure gauze to the area. Get the person to the closest emergency department. Interesting, they have like restricted access. If you guys ever walk around the hospital, you'll see signs everywhere that's like staff only, restricted access. It's actually quite interesting. Like I have a badge at the hospital that it's actually set up to only allow me in certain areas. Oh, whoa, wait, is that a leg going flying? What is that? It looks like directly at the knee. We typically have AKA or a BKA. The knee is made up of your kneecap, proximal part of your tibia, and the distal part of your femur. Wow. Hanging by your wrists in that position can cause significant amount of pain, not only to the wrist, but to the shoulder joints, to the muscles of the chest and the rotator cuff of your shoulder. Oh. We do see this happen in the emergency department occasionally where blood just gets splattered everywhere, or even patients spitting, patients throwing poop, throwing urine, vomiting. There's a lot of different liquids that get thrown around that could end up on walls, the floor, on people. Whoa, we got some new hands. Cool. That you have a prosthetic and have the ability to change out different types of prosthetics. I know individuals who say are runners, they have like a normal like leg prosthetic and then they have their running one. That's like the blade. I know people have probably seen those. As technology gets better moving forward in the future, there are a lot more options that are coming to fruition. And there could be a point where they have the ability to be controlled by your brain. Oh, we got some electrical energy. Injuries by electricity. Typically, the only time we see electrical type injuries, work sites or somebody's accidentally like hitting an outlet. Most of the time they're low energy and they don't cause significant amount of issues. Just like when the law enforcement uses, say, a taser or those barbs that shoot out and would tase somebody, that is typically within the soft tissue itself, not causing cardiac arrest or any long-term damage, more just causes incapacitation for a very short period of time and discomfort. When they do come to the emergency department, a lot of times those barbs are still stuck, so we have to remove those with force because they'll just come right out, or we have to actually cut them out. If somebody comes into the emergency department with an electrocution type injury, we also want to check to see if there's any breakdown of muscle tissue for rhabdomyolysis, checking out a CPK level. And then obviously we want to check their kidney function as well to make sure it's not getting clogged up due to muscle breakdown. We went from a shock to on fire to being burned. Electrical injuries could cause burns on the inside, but then you do have burn injuries that we do worry about outside of like 1st degree, 2nd degree, 3rd degree, 4th degree burns. You worry about when the burn is that bad that it's engulfing around the individual, that they're breathing in the flames, causing airway disruption, causing melting of the tissue, causing swelling of the tissue, and then taking the oxygen away so you actually can't breathe. Not so much. Whoa! Wow. This one was crazy. What crazy apparatus. It almost looks like Wolverine's claws. Stab right through. Maybe the head is where the motherboard is for these toys and creatures. But again, same thing for humans. But if you stab too low, if you're going through the mouth in a human, you're going more like brainstem and lower part and cerebellum versus like the higher functioning part of your brain, which is higher up in the dome up here. If you have an injury to the brainstem, that's where your autonomic nervous system helps to communicate to everything else, and you might not have function of your ability to breathe or have a heartbeat. We at the hospital do have devices to actually help lift patients, especially if they are a little bit too heavy for an individual lift, because then you don't want to increase the risk of hurting somebody else. If somebody, say, has dead weight, not that they're dead, but they don't have the power to help themselves to lift, that is heavy. Individuals anywhere between 100 to like 500 pounds, yes, you can really hurt yourself because they're also in a bed or in a chair and you're using abnormal mechanics to be able to help them up. So if somebody's trying to lift somebody up from their jaw with their hand in their mouth, would there be any injuries? Maybe some teeth coming out. The jaw would probably stay intact, especially the upper jaw, which is your maxilla, which is attached to your skull.